Metolazone is a thiazide-like diuretic used to treat hypertension. In this video, let's find found. What is metolazone? What is metolazone used for? Contraindication. What are the side effects of taking metolazone? How does metolazone work? How to use metolazone? What is metolazone? Metolazone is a thiazide-like diuretic marketed under the brand names Zytanix, Metoz, Zaroxolyn, and Mykrox. It is primarily used to treat congestive heart failure and high blood pressure. It was patented in 1966 and approved for medical use in 1974. What is metolazone used for? For the treatment of hypertension, alone or in combination with other antihypertensive drugs of a different class. Contraindication. Metolazone is contraindicated for patients known to have documented hypersensitivity to metolazone or sulfonamides, failure of the kidneys to produce urine and urea, hepatic coma or pre-coma. Side effects: black, tarry stools, bleeding gums, blistering, peeling, or loosening of skin, bloating, blood in urine or stools, bone pain, chest pain, clay-colored stools. Pharmacodynamic. Metolazone is a quinazoline diuretic, with properties generally similar to the thiazide diuretics. A proximal action of metolazone has been shown in humans by increased excretion of phosphate and magnesium ions and by a markedly increased fractional excretion of sodium in patients with severely compromised glomerular filtration. This action has been demonstrated in animals by micropuncture studies. Mechanism of action. The actions of metolazone result from interference with the renal tubular mechanism of electrolyte reabsorption. Metolazone acts primarily to inhibit sodium reabsorption at the cortical diluting site and to a lesser extent in the proximal convoluted tubule. Sodium and chloride ions are excreted in approximately equivalent amounts. The increased delivery of sodium to the distal tubular exchange site results in increased potassium excretion. Metolazone does not inhibit carbonic anhydrase. The antihypertensive mechanism of action of metolazone is not fully understood but is presumed to be related to diuretic and diuretic properties. Half-life: approximately 14 hours. Dose: hypertension 2.5 to 5 mg PO once daily, may be increased to 20 mg once daily PRN. Edema: 2.5 to 10 mg PO once daily initially, may be gradually increased to 20 mg once daily. Safety advice. Metolazone has been assigned to pregnancy category B by the FDA. Animal studies have failed to reveal evidence of teratogenicity. That's all the information about metolazone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.